Welcome back for another deep dive, and you guys are not going to believe this. This time, it's head and neck anatomy.
Really essential stuff.
You sent over a whole stack of textbook excerpts.
Oh, yeah.
And let me tell you, this is the need-to-know info for any nursing student or faculty.
Absolutely.
We're going to distill it down to the key facts, perfect for acing an exam, or just impressing your colleagues.
Or, just, providing really great care.
Oh, absolutely.
Being a competent nurse.
Yeah.
Knowing your stuff.
Okay, so let's unpack this.
Yeah, let's get into it.
Did you know that even the regions of the head, like they're named after the skull bones? Talk about anatomical organization.
It's true that organization is so helpful for pinpointing your findings during an exam.
Right.
So, for example, if you have a patient with a head injury, knowing that the temporal region is named for the temporal bone helps you to quickly locate and assess that superficial temporal artery.
Right, and speaking of things you can feel, did you know that you can actually feel the parotid gland when it's enlarged?
Yes, you can.
It's the one that gets all swollen with the mucus.
Right.
You get this. The opening of its duct is actually visible inside the mouth.
It is. It's amazing how much is packed into such a small area.
Right.
And let's not forget about the segmendibular gland, which sits deep to the mandible.
Oh, yeah.
You can actually feel it if you press your tongue against your lower incisors and tighten those muscles.
Oh, wow.
These glands are so important to recognize because they can be affected by a whole range of conditions, infections, tumors, all kinds of things.
Now let's shift our focus down to the neck. It's like this intricate roadmap of muscles and vessels and nerves.
Absolutely.
All carefully organized.
It's beautifully organized.
The sternocleidomastoid muscle, or SCM as it's often called,
Yes.
is a key landmark here.
It is.
It divides the neck into two major triangles, the anterior and posterior triangles.
Absolutely. The anterior triangle is bordered by the mandible, the SCM, and the midline of the neck.
Okay.
While the posterior triangle is formed by the SCM trapezius muscle and the clavicle. But there's a potential pitfall here that nurses need to be aware of.
Okay.
The omohyoid muscle, which crosses the lower posterior triangle, can sometimes be mistaken for a lymph node.
Oh, wow. I could see how that could happen. What are the implications of mistaking that muscle for a node?
Well, imagine a nurse palpating the neck and feeling what they think is an enlarged lymph node.
Right.
That could lead to unnecessary worry, additional tests, and even delayed diagnosis if it's not recognized.
Wow.
So that's why a solid understanding of the anatomy is so crucial.
It's like having a mental map that helps you navigate the terrain and avoid those potential pitfalls.
Exactly.
Now let's dive deeper literally and talk about some of the structures that lie beneath those SCM muscles. We've got some real VIPs here.
Yeah.
The carotid artery and the internal jugular vein.
These are definitely high-stakes structures. The carotid artery is the major supplier of blood to the brain.
Right.
So any compromise there can have serious consequences.
Yeah.
And the internal jugular vein is the main highway for blood returning from the head. Nurses need to be extremely careful when working in this area.
Yeah, you can see why.
Yes.
Any procedures involving these structures definitely fall into the measure twice, cut once category. But hey, there's also the external jugular vein, which is a bit easier to see. It runs diagonally across the SCM, right?
That's right, and it's a helpful landmark when you're assessing jugular venous pressure.
Oh, okay.
That's a key assessment for nurses, especially when monitoring patients with heart conditions.
Now let's move to the midline of the neck. Here we find a fascinating set of structures that are essential for breathing and swallowing.
Yes, very important.
First up, we've got the hyoid bone.
Yes.
This little guy is unique because it's the only bone in the body that doesn't directly connect any other bone.
That's true. It's almost like it's floating there.
Wow.
But it plays a critical role in supporting the tongue and anchoring muscles involved in swallowing. And then moving down, we encounter the thyroid cartilage, which is easily identifiable thanks to that prominent notch on its superior edge, the Adam's apple.
Ah, the Adam's apple. I remember learning about that in anatomy class. Below that, we have the cricoid cartilage, which is another important landmark.
Yes.
Because it's often used as a reference point when performing certain procedures, like a tracheostomy.
Right.
And finally, we reach the tracheal rings.
Yes.
These C-shaped rings provide structure and keep the airway open.
They do. These midline structures are essential for life.
Right.
Any injury or compromise to this area can have a significant impact on a patient's breathing and ability to swallow.
Definitely a good reminder to always be extra cautious when working around the neck. Now, I have to ask about the thyroid gland. It's this small butterfly-shaped organ that sits right on the trachea, but it plays such a massive role in the body.
The thyroid gland is a powerhouse.
Right.
It produces hormones that are essential for regulating metabolism, growth, and development. It's typically located just above the suprasternal notch.
Okay.
And the isthmus, or the connecting piece, spans the second, third, and fourth tracheal rings.
Oh, wow.
The lateral lobes curve around the sides of the trachea and esophagus.
So it's nestled in there pretty snugly. I remember learning that each lobe of the thyroid is about the size of your thumb.
About that, yeah.
And you can actually watch it move when someone swallows during a physical exam.
You can.
It's those little details that make anatomy come alive.
It's fascinating, isn't it? The thyroid is like a tiny conductor orchestrating so many vital functions in the body.
Speaking of essential functions, let's move on to the lymph nodes. These tiny structures are like the body's security guards, filtering lymph fluid and trapping those pesky pathogens.
They're key players in the immune system.
Mm-hmm.
And for nurses, understanding lymphatic drainage patterns is crucial.
Yeah.
Where there's a swollen node, you need to think upstream to find the source.
Right.
It could be an infection, inflammation, or even something more serious.
It's like a detective game following the trail of clues to figure out what's going on. I know we've talked about the submandibular gland already.
Yeah.
But I remember from my anatomy classes that it can be easy to confuse it with a lymph node.
You're absolutely right. That's another one of those anatomical pitfalls that nurses need to be mindful of.
Yeah.
The submandibular gland is larger and has a more irregular surface compared to lymph nodes, which are typically smaller, rounder, and smoother.
Okay, let's get hands-on for a minute. Have you ever had to palpate someone's lymph nodes?
Of course.
It's like a gentle treasure hunt feeling for these tiny structures beneath the skin.
Palpating lymph nodes is a fundamental skill for nurses.
Right.
It's all about using gentle circular motions with your fingertips to assess each group of nodes. We start with the submental nodes, which are just behind the tip of mandible.
And then we move to the submandibular nodes, which are located about halfway between the angle and the tip of the mandible, right?
Exactly. And don't forget the preauricular nodes in front of the ear.
Right.
And the posterior auricular nodes behind the ear.
Okay.
These are often involved in infections of the ear and scalp.
Oh, okay.
And then we have the tossular node, which sits at the angle of the mandible.
Right.
That one often gets enlarged with the sore throat.
Of course, we can't forget about the occipital nodes at the base of the skull. Feeling around the neck might seem a little strange at first, but it's so important to get to know what normal feels like so you can spot any deviations.
Absolutely. And when you're palpating those nodes, you're assessing their size, shape, consistency, and tenderness.
Yeah.
Tender nodes often suggest inflammation,
Okay.
while hard or fixed nodes could be a sign of something more serious like malignancy.
Those are definitely red flags that warrant further investigation.
Absolutely.
So we've explored the lymph nodes like expert detectives. Now let's shift our focus down to the trachea, that vital airway that carries air to the lungs. You can actually feel the tracheal rings beneath the skin. It's pretty amazing.
You can, and don't forget to check for tracheal deviation during your assessment.
Oh, right.
If the trachea is shifted to one side, it could indicate a problem in the chest,
Okay.
such as a mediastinal mass, a collapsed lung, or a large pneumothorax.
You can also listen over the trachea with your stethoscope, right?
Absolutely. Auscultating over the trachea allows you to assess the quality of airflow and listen for any abnormal sounds. For example, stridor, a high-pitched sound,
Right.
is a sign of a serious airway obstruction.
That's definitely something you wouldn't want to miss. Now let's revisit the thyroid gland, our little hormone powerhouse. We've talked about its location and how to watch it move during swallowing.
Right.
But how do we actually go about examining it?
When examining the thyroid, you want to start with inspection.
Okay.
Look for any visible enlargement or asymmetry. Then use palpation to assess the gland's size, shape, and consistency.
Right.
You can use either a posterior or anterior approach, whichever you find more comfortable.
I remember learning that a goiter, which is an enlarged thyroid,
Yes.
can sometimes be visible even before you palpate it.
That's right.
And if you feel any nodules during palpation,
Right.
those definitely need careful attention.
That's right. While most thyroid nodules are benign, certain characteristics like hardness or rapid growth raise concern for malignancy.
So it's important to document those details carefully. It's all about piecing together those clues like a medical detective.
And don't forget to listen over the lateral lobes of the thyroid with your stethoscope.
Oh, right, yeah.
A bruit, which sounds like a soft whooshing, can indicate increased blood flow to the thyroid,
Okay.
which is often a sign of hyperthyroidism.
Wow, we've covered a lot of ground today, from the surface anatomy to the deep structures. The head and neck are packed with incredible details.
They are.
It's like a complex puzzle.
It is.
But with practice and attention to detail, we can become experts at navigating this vital part of the body.
It really is, and it's a reminder that even seemingly small structures can have a big impact on a patient's health.
Right.
Speaking of impact, let's transition into talking about some common and concerning symptoms.
Yeah.
that patients might present with. Neck masses or lumps, for example,
Okay.
are something we encounter frequently.
Those could be a bit unnerving, right?
They can be very unnerving.
I imagine finding a lump in your neck can be pretty alarming for anyone.
Absolutely.
It makes you think of all sorts of worst-case scenarios.
It does. It causes a lot of anxiety for patients.
Yeah.
And as nurses, we need to approach those situations calmly and systematically.
Right.
So when patient reports a neck mass, it's crucial to gather a detailed history. When did they first notice it?
Okay.
Is it painful? Has it changed in size or shape? Are there any other symptoms like difficulty swallowing, breathing, or even discharge?
It's like putting together a puzzle.
Right.
Trying to piece together those clues to figure out what's going on.
Exactly.
And I imagine age plays a big role in our assessment too, right?
Absolutely. A persistent neck mass in an adult over 40 definitely raises a red flag for malignancy.
Okay.
While enlarged, tender lymph nodes
Right.
often accompany common infections like pharyngitis or tonsillitis,
Right.
a persistent mass warrants further investigation.
Okay, so that's definitely something to keep in mind. Now let's talk about the thyroid,
Okay.
specifically thyroid masses, nodules, or goiters. It's incredible how much this tiny gland
It is.
can influence the entire body.
It really is. The thyroid is involved in so many vital functions, from regulating metabolism
Right.
to influencing growth and development. When assessing a patient for potential thyroid issues,
Okay.
it's important to consider symptoms related to both hypothyroidism and hyperthyroidism.
Can you give us some examples of those symptoms?
Sure.
I remember learning about them in class, but a refresher is always helpful.
Of course, so think about temperature intolerance.
Okay.
Someone with hypothyroidism might always feel cold even when others are comfortable. They might also notice weight gain, dry skin, and fatigue. On the other hand, a person with hypothyroidism might feel hot and sweaty even in cool temperatures. They might experience weight loss, a rapid heartbeat, and anxiety.
It's fascinating how such opposite symptoms can stem from the same gland. So when a patient comes in with those kinds of symptoms,
Right.
we need to think about the thyroid as a possible culprit.
Exactly. And when it comes to goiters, those enlargements of the thyroid gland, it's important to remember that thyroid function could be increased,
Okay.
decreased, or even normal.
Wow.
It's not always a straightforward diagnosis.
It sounds like we need to be real detectives when it comes to assessing the thyroid.
We do.
Speaking of assessments, let's zoom out a bit and talk about the importance of a systematic head and neck exam.
Okay.
I remember from nursing school how important it was to have a clear roadmap in mind.
You're absolutely right. Having a systematic approach ensures that you don't miss any crucial details.
Right.
We want to inspect every nook and cranny, starting with the hair and scalp, looking for any abnormalities.
Okay.
Then we move on to the skull, feeling for any deformities or tenderness.
Mm-hmm.
And of course, we can't forget the face.
Right.
It can tell us so much about a person's overall health.
It's like a window into their well-being. I remember learning about how certain facial features
Right.
can be clues to underlying conditions.
Exactly. Observe the patient's facial expression.
Mhm.
Look for any asymmetry or involuntary movement.
Okay.
And note any edema or masses. The face can provide insights into a wide range of conditions, from neurological disorders to endocrine imbalances.
It's amazing how interconnected everything is. Now, we've already talked about palpating lymph nodes,
Right.
but it's worth emphasizing the importance of being thorough and systematic with that part of the exam.
Absolutely. We want to feel for each group of nodes,
Mhm.
noting their size, shape, consistency, and any tenderness.
Yeah.
Remember, small, mobile, discrete, non-tender nodes
Okay.
are often found in healthy individuals, but if you find enlarged tender, hard, or fixed nodes,
Yeah.
those warrant further investigation.
It's all about knowing what's normal and what's not. Okay, so we've covered inspection and palpation of the head and neck.
Yes.
Now, what about auscultation? I remember using my stethoscope to listen to the heart and lungs.
Right.
But are there any specific sounds we should be listening for in the head and neck region?
Great question. We've already talked about listening over the trachea for any abnormal breath that sounds like stridor.
Right.
But we also want to listen over the carotid arteries
Okay.
for any bruits,
And there?
those whishing sounds that can indicate turbulent blood flow.
Ah, yes. I remember learning about carotid bruits.
Yeah.
Those could be a sign of carotid artery stenosis, which is a narrowing of the artery, right?
Exactly. And that narrowing can increase the risk of stroke.
Wow.
So it's definitely something we want to catch early.
So listening with our stethoscope can provide some really important clues about what's going on beneath the surface.
It can.
Now, I want to circle back to the thyroid gland for a minute. We've already talked about palpating it,
Right.
but I remember learning that sometimes you can actually see a goiter just by looking at the neck.
You're right. Inspection is a crucial part of the thyroid exam.
Okay.
Use tangential lighting to observe the contours of the gland and watch the patient swallow to see how the thyroid moves.
Right.
This can help you identify any subtle enlargement or asymmetry.
Okay.
And if you do find any nodules during palpation,
Yeah.
be sure to note their characteristics carefully.
Right. We want to document whether they're soft, firm, or hard.
Yes.
And whether they're fixed to the surrounding tissues or movable.
Exactly.
Those details can help guide further investigation and management.
You've got it, and don't forget about auscultating over the thyroid to listen for those bruits we talked about earlier.
It's amazing how much information we can gather just by looking, feeling, and listening.
It is.
It's like we're putting together a detailed map of the head and neck,
Yes.
looking for any signs of trouble.
It really is, and it highlights the importance of being thorough and systematic in our assessments.
Right.
Even seemingly small findings can have significant implications for a patient's health.
Now, I know we've been focusing on the anatomical structures and how to assess them,
Right.
but I'm also curious about the health promotion and counseling aspects
Okay.
of head and neck health. Are there any specific things we should be discussing with our patients
Yes.
to help them stay healthy?
That's an excellent question, and it's a crucial part of our role as nurses.
Yeah.
Let's start by talking about screening for thyroid dysfunction.
Okay.
It's a common health concern,
Right.
and it can manifest in a variety of ways, from subtle symptoms to more overt signs.
So how do we know when to screen for thyroid dysfunction?
Okay.
Are there any particular red flags or risk factors we should be looking out for?
Absolutely. The risk of hypothyroidism increases with age,
Okay.
and it's more common in women, especially those with a family history of thyroid disease,
Okay.
type 1 diabetes, or a history of radiation exposure to the head and neck.
Well, those are definitely things we want to ask about when taking a patient's history.
Absolutely.
What about hyperthyroidism? Are there any specific groups that are at higher risk for that?
Hyperthyroidism is also more common in women and tends to increase with age.
Okay.
Other risk factors include African ancestry, low iodine intake, and certain medications like amiodarone.
It sounds like we need to be really attentive to those risk factors
Yes.
and consider screening for thyroid dysfunction when appropriate. Now, what about screening for thyroid cancer? It's not as common as thyroid dysfunction,
Right.
but it's still something we need to be aware of.
You're right. While most thyroid nodules are benign,
Right.
certain characteristics raise concern for malignancy.
Okay.
For example, a nodule that's large, firm, fixed to surrounding tissues or growing rapidly should be evaluated further.
So how do we go about screening for thyroid cancer?
Okay.
Is it as simple as feeling the thyroid gland during a physical exam?
Palpation is certainly part of the assessment,
Okay.
but it's not enough on its own.
Right.
Ultrasound imaging is often recommended to evaluate thyroid nodules and determine whether a biopsy is necessary.
So it's a multi-step process. We start with a thorough history and physical exam,
Yes.
paying close attention to any risk factors or concerning symptoms.
Yes.
Then, if warranted, we use imaging studies
Right.
and possibly a biopsy to rule out malignancy.
That's a great summary, and it highlights the importance of staying up to date
Right.
on screening guidelines and best practices.
Yeah.
The medical landscape is constantly evolving, and we need to continually expand our knowledge and skills
Right.
to provide the best possible care for our patients.
It's like we're lifelong learners, always striving to improve and refine our practice.
We should be.
Speaking of lifelong learning, I think we've covered an incredible amount of information in this deep dive. We've explored the intricate anatomy of the head and neck, discussed how to assess this region, like seasoned detectives,
Yeah.
and even touched upon the importance of health promotion and screening. It's amazing how much we've packed into this deep dive, but I think we have time for one more crucial aspect of head and neck health. I remember from my clinical rotations that head and neck cancers can be quite common.
You're right. Head and neck cancers are a significant health concern, and they can affect various sites in this region, including the oral cavity, the pharynx, the larynx, and the salivary glands.
Wow, so many different areas can be affected. What are some of the common risk factors associated with head and neck cancers? I'm guessing tobacco use is probably a big one.
You are absolutely right. Tobacco use, including smoking and chewing tobacco, is a major risk factor for these cancers. In fact, it's estimated that tobacco use accounts for about 75% of head and neck cancers.
That's a staggering statistic. It really highlights the importance of educating our patients about the dangers of tobacco use and encouraging them to quit if they're current users.
Absolutely. Counseling on smoking cessation is a crucial part of our role as healthcare providers. And it's not just tobacco. Excessive alcohol consumption is another significant risk factor.
So it sounds like lifestyle choices play a big role in head and neck cancer risk. Are there any other risk factors we should be aware of?
Yes, there are. Certain viral infections like human papillomavirus, HPV, have been linked to an increased risk of head and neck cancers, particularly oropharyngeal cancers.
HPV is a sexually transmitted infection, right? So it's not just affecting the cervical area.
That's right. Certain strains of HPV can infect the cells in the back of the throat, increasing the risk of cancer in that area.
That's something I'm sure many people aren't aware of. It's definitely important to educate our patients about the link between HPV and head and neck cancers.
Absolutely. And there are vaccines available that can help protect against HPV infection. So discussing vaccination with our patients, particularly younger individuals, is an important part of cancer prevention.
It sounds like early detection is key when it comes to head and neck cancers. Are there any specific signs or symptoms we should be looking out for?
Yes, there are several warning signs that patients should be aware of and report to their healthcare provider promptly. These include a sore throat that doesn't go away hoarseness, or a change in voice, difficulty swallowing, a lump in the neck, a white or red patch in the mouth, and unusual bleeding or numbness.
Okay, let me make sure I've got all that. So we're talking about a sore throat that doesn't go away hoarseness, or a change in voice, difficulty swallowing, a lump in the neck, a white or red patch in the mouth, and unusual bleeding or numbness. Those are all red flags that shouldn't be ignored.
Exactly. Early detection is crucial for improving outcomes with head and neck cancers. If a patient reports any of these symptoms, it's important to refer them for further evaluation, which might include a physical exam, imaging studies, and possibly a biopsy.
It sounds like we have a crucial role to play in both preventing and detecting head and neck cancers. From educating patients about risk factors and promoting healthy lifestyle choices, to being vigilant during our assessments and knowing when to refer for further evaluation, we can make a real difference.
You're absolutely right. As nurses, we are often at the front lines of patient care, and our knowledge and attentiveness can have a profound impact on patient outcomes.
Well, I think we've truly taken a deep dive into the world of head and neck health today. We've covered so much ground, from the intricate anatomy to common symptoms, potential emergencies, and even health promotion and cancer prevention. I feel like I've not only refreshed my knowledge, but also gained some valuable new insights.
It's been a pleasure exploring these topics with you. Remember, the head and neck region is complex and fascinating, and a strong understanding of this area is essential for providing competent and compassionate care to our patients.
And to our listeners out there, whether you're a nursing student hitting the books or a seasoned nurse educator guiding the next generation, remember that learning is a lifelong journey. Keep those brains buzzing, those stethoscopes warm, and never stop exploring the amazing world of healthcare. Thanks for joining us on this deep dive. TEFE.